So next up is an important part of this event where we're going to have trainee presentations. So each year we invite trainees from across the province to come in and talk about some of the work that they're doing related to the event that we're hosting. Now, the students each will have just 3 minutes to tell you about the work that they're doing, and to explain the importance. They do an amazing job of this, so I know you're going to enjoy it. So there's going to be 8 trainees that will present to us today. We'll break up the presentation into 2 rounds, so we'll do a round of 4, and then you'll have a chance to ask some questions, and then we'll have a break where we'll have coffee, tea, snacks, and a few things like that just outside the auditorium. You can, of course, have a chance to talk with some of the trainees and learn a little bit more during that time. And then we'll come back and we'll do the remaining presentations at that time. So we have the presenters here, and I'd like to start by introducing our first presenter, who's Janessa Griffiths from the University of Toronto. So welcome.
Hi. As Dr. Roshan mentioned, I'm Janessa Griffith, and I'm a PhD candidate at U of T and based here at Women's College. So I would like to begin by, if everybody can bring out their smartphones, and if you don't have a smartphone, maybe turn to your neighbor. Now I want you to do a Google image search of the word heart attack, the words heart attack. And when that comes up, I want you to scroll down until you've seen images of 5 women. And see how long that takes you. That'll take that might take you 15 minutes. So what you'll probably see are variations of the same image. Usually a white man, clutching his heart, sometimes usually at a golf course. And when we consider images, we have to consider how these are represented for people looking at them. So what I found, I won't make you go through all of the images out there, but what I found was that 64% of the images were of men and 35% were of women. Also, 86% were of Caucasian people. And so this is a problem because the majority of Canadians turn to the internet for health information. So based on these images, would you know that that heart disease is the #1 killer of women in Canada? Would you know that 54% of women are unaware of their risk? Based on these images, would you know that women are Indigenous women and women of Chinese, Afro-Caribbean, and South Asian descent are at a greater risk of developing heart disease? You probably wouldn't. And previous research shows that a poor reflection of images can influence how women perceive the risk of heart disease. So as a proof of concept, I recently discovered coffee for the first time and decided to learn Python. And I created this machine learning program where it can classify images. So I took a whole bunch, hundreds of images of women, that's bucket A, hundreds of pictures of men, that's bucket B, and I processed them through an algorithm that I created. Now, that algorithm it extracted features from the images, so it learned how to classify a man, how to classify a woman of an image of them having a heart attack. So when I presented a new image, the machine, my computer program, would output its decision of whether it was a man or a woman. Now, this is important because now that we can classify images of people, not only heart attacks, but other other diseases, we can identify inequities, and we can also, in the future, perhaps assign a relevant score to that image so that when you're searching, it will show up higher in your search. One huge problem with this, I hope everybody saw this flaw, the output, it's a binary. It's reinforcing binaries. And for me to be able to train the machine, I need to have hundreds of images of a particular gender. So right now, it's we need to focus on how to make algorithms more equitable. So with that, I would just like to say that we can let the phones be smart, but we need to be wise. Thank you.
So thank you very much. And now we're going to move on to a presentation from Florida Doci from the University of Ottawa.
Hi, everyone. I'm really excited to be here today and present on a research project that we conducted at the University of Ottawa. And thanks, Jessica, for giving us a preview of what women have to go through in terms of getting STI screening. In fact, young adults in Canada have the highest rates of sexually transmitted infections, such as chlamydia and gonorrhea. And the lack of sex-positive education, the fear of judgment, the stigma pose barriers to young women seeking STI screening. So at the University of Ottawa, we conducted a mixed method study among women students using an internet-based self-screening tool for STI, and more specifically, we used the HerSwab TM kit that was provided by Eve. So during the study, we recruited female students to participate in a baseline survey that assessed knowledge, awareness, and experiences with STI screening. We invited eligible participants to use a free HerSwab self-screening kit, and then we conducted follow-up interviews with a subset of women that used the kit, and we also conducted a follow-up survey with all the women that joined the study. So in total, we collected 791 complete responses through our survey, and we distributed 408 self-screening kits. So the majority of the participants, around 75% of them, perceived their overall knowledge of STIs as good or average, and they felt sufficiently informed to avoid the risk of STI transmission. However, only half of the participants have ever been tested for STIs of any type ever before. Also, more than half of the participants reported obtaining information about STIs from different websites, where we know that information is not always medically accurate. So 205 women participants obtained internet-based STI screening through HerSwab kit that was provided during the study. Women who used the kit found that digital-based testing is easy to use, it's convenient, and it's discreet. Women appreciated that they could collect the sample in the comfort of their home, as Jessica showed us the pictures, and they appreciated that they could receive start-to-end screening experiences with minimal to no interaction with service providers. Findings from the follow-up interviews indicated that digital-based screening services could increase screening rates among young women. This novel approach can actually address the need for more accessible, youth-friendly, non-judgmental, and sex-positive STI testing. Also, women participants found that the cost of the tool is a deterrent to the accessibility of digital-based STI screening. So it is important that this is addressed, and making internet-based STI screening services more affordable and more accessible to young women. Thank you.
So thank you very much. And our next presentation will be from the University of Ottawa, and this is from Louisa Marvel-Peck. Welcome.
Hello, everyone. As you know, my name is Louisa Marval, and I'm super happy to be here today to present to you a very quick snapshot of my thesis project entitled Self-Administration of Very Early Medication Abortion Provided Through a Global Online Telemedicine Service. So let's get started. In areas where abortion is legally restricted, as well as those where it's permitted by law but not widely accessible, women are increasingly choosing to terminate their unwanted pregnancies outside of the formal healthcare system, and they're doing so facilitated by telemedicine services. So here on the slide, you'll see a web page of the Women Help Women direct-to-patient abortion telemedicine service, which was our partner for this study. And they provide mifepristone and misoprostol combination of medication abortion. So we know that medication abortion methods are effective for pregnancy termination, but how early can we use these methods? Can we use them immediately after the period, after knowing that your period has been missed? So our aim for this study was to assess the safety, efficacy, and acceptability of home administration of very early medication abortion, so 28 to 35 days last menstrual period, in low resource and legally restricted settings provided through the Women Help Women telemedicine service. So we looked at 2 data sets. We looked at the consultation data, which is the first step that women do. They go on the site and they fill out this information. So we analyzed 1,123 online records of women who contacted the site from 2015 to 2018, and this looked at demographics information, circumstances surrounding the pregnancy, gestational age, medical history, and the second set of data was the follow-up data. This is after the pills have been sent, and it looks at women's satisfaction with the medication abortion online service, reported side effects, and the symptoms that led to additional medical treatment. So for the results, what we found was in the consultation results was that 64% of the respondents were 4 weeks pregnant and 35% were 5 weeks pregnant. The Women Help Women sent medications to women seeking very early abortion in 16 different countries and territories, and the main ones were Brazil, Ireland, and Thailand. And the second set of data here is the follow-up evaluation. And the main things to take away from this is of the women who did take the medication, 98% reported that the abortion was successful. And of those that took the medication, 11% sought medical care, and the overwhelming majority were satisfied with both the online support received and the abortion procedure. So as we can see, very early medication abortion methods are safe, acceptable, and feasible in low resource and or legally restricted settings. Thank you.
So thank you very much. And the last presentation in this series is going to be from Hiba Ahmed from the University of Toronto. Welcome.
Hi everyone, my name's Hiba, and along with my co-authors, including supervisor listed here, we developed and evaluated an elder abuse nurse examiner e-learning curriculum. Oops. Sorry, do I press? Oh, there. Okay. So currently, there's no standard province-wide provision of dedicated care for abused older adults in Ontario's hospital-based sexual assault and domestic violence treatment centers. This new e-learning curriculum is developed to improve the knowledge and competency of forensic nurses working at these centers in delivering care to diverse older adults who've experienced elder abuse, a problem that disproportionately and differently impacts women. This e-learning curriculum builds substantially upon an existing in-person curriculum, and it was developed using 47 skill-based competencies informed by scholarly literature, and it was categorized into 5 meta-competencies, which are documentation, legal and legislative issues, interview with older adult caregiver in other relevant contexts, initial assessment, medical and forensic examination, and case summary, discharge plan, and follow care. So this e-learning curriculum is developed using Storyline 360 by Articulate, an award-winning software for the design of interactive courses, and it was guided by evidence-based principles of multimedia learning. and reviewed by external experts, Doctors Robin Mason and Deborah White, who are experts in online curriculum design and evaluation. This e-learning curriculum consists of multiple interactive elements, some of which are highlighted here in a montage, and they consist of embedded content, embedded content, information boxes. It's a bit slow. So that would be like the information boxes. Learners can click on it and get extra information. Game-based learning activities to keep it engaging. Knowledge checks. Case studies. And then these case studies are followed up by with reflection pauses for the learners. And then there were key points, and it was followed by additional resources that the learners could use after every module. So, pre- and post-training questionnaires, which included a clinical vignette designed to stimulate a hypothetical client visit and assess actual competency in the care of abused older adults in a clinical practice, have also been developed. And satisfaction of the e-learning curriculum will also be gathered using an evaluation survey. Thank you.
So thank you very much. Excellent presentations. Can I have the presenters come and join me down here at the podium? And it's time for questions. If people have questions related to the presentations. Sorry, can you all? So questions, thoughts? Yes.
I have a question for Janessa. Janessa, what motivated you to pay attention to this issue in particular?
Good question. A couple of things. I was Googling Google Imaging Captain for some reason. My brother, my dad, they're all in the marine industry, and I was like, there's no women, no wonder. I was thinking, like, why didn't I decide? I love the ocean. Why didn't I decide to go down this career path? And then my grandmother had a heart attack last year, and she denies it. Like, she definitely had it. And she said, no, like, I didn't, it's not what you see on TV. It's not this Hollywood heart attack. So it's just like an example of how you don't see yourself reflected in these images. So it kind of plays a part in what you should look for. And especially because women, sometimes they're more silent heart attacks, and you might delay going to the hospital or seeking care. So yeah, I just thought image portrayal was important.
Thank you. Other questions? Yes.
Florida, how did you get the cost covered for the HER swabs, and what is the cost?
So currently the swab is available online, and it can be purchased for roughly 85 Canadian dollars. So you can actually get the swab available online and go through the whole process of testing. For purposes of the study, we partnered with Eve Medical, who provided us the kits for all of the participants in the study.
Oh, hey, this one's just for Heba. Great presentation, by the way. It was awesome. And I think the stuff you're looking at is really important. Now, for me, I've done a bunch of, like, as a women's college employee, and I'm sure a lot of people in this room can probably speak to this, but sometimes the e-learning modules, oftentimes people will sort of flip through and just get it done to get it done. Have you looked at potentially, like, I know you'd mentioned there's not really a lot of evaluations done in the typical nursing curriculums. Have you looked at sort of program changes in universities that might potentially result in a higher retention of some of this information?
So to answer your first part, yeah, a lot of times people will just like flicker through the curriculum. And so one way we tried addressing that was actually restricting it so that there's 6 modules. So the learner would have to actually complete every module. And these nurses are also getting a certificate towards the end. It's like a completion. So they wouldn't actually be able to, so even if they tried clicking on like another tab on the internet, like, and have it rolling, they wouldn't actually be able to do that. And in terms of like looking at university courses and stuff, I'm sorry, I'm not too familiar, but maybe Megan, who's also one of my team members, can maybe elaborate a little bit more on that. She's sitting right in front of you, actually.
Absolutely. So actually, one reference that we included in the abstract of this presentation actually came from a systematic review of e-learning or online curricula used in health professional education, which actually found that these curricula can be as effective as regular in-person curricula for satisfaction, accessibility, and the retention of knowledge. So there definitely is literature out there, and specifically in health professional education, that shows that these types of curricula can be effective.
And I just have one last question, and Louisa, you might want to think about this. Could you imagine doing your projects without using some sort of a technology?
This question's for me. Yeah, it would be very difficult. But I mean, the only other way would be to travel to each of these countries to speak to women and interview them. So yeah, it would be very difficult. So I'm very grateful that we have the internet available to be able to do this research.
Well, thank you, everyone. Amazing presentations. Thank you very much.